I misinterpreted his sentence. Now I don't know how I could have done anything different, because I specifically asked him the question, about the swelling, and I don't know if it's even answerable. It was just, I asked him the question and I got an answer that apparently, like, I can't even begin physical therapy now because the swelling's too bad, which is what I was asking the doctor about. So I don't know how that could have gone better.
Had the experience where you were in the office with a follow-up for your surgery on your foot, for a foot injury, and you're now concerned that your instructions were not
Correct.
Helpful.
Yeah.
I'll make believe that I'm the patient, and I have some questions for you, and then I want you to demonstrate what the doctor say. You have to be persistent. You have to address, if the doctor doesn't have enough time, if they don't have 5 or 10 minutes for you, then they would have to be honest about that. There are problems that can occur, injuries to people, even death, if they don't get safe care. So we're going to address that today. And if you haven't heard about this as a problem, then you're going to hear a lot more today about that. And a common problem that's connected to both of those is needing more time with the doctor. This is very important, to get enough time that you understand what's going on with you. After all, healthcare is for benefit of you, not for the healthcare system or the healthcare provider. Activists today for your safety, okay? You're going to learn to ask the doctor, the nurse, did you wash your hands? I didn't see you wash your hands. Maybe. And so we're trying to empower you to partner with the healthcare team, okay? And studies of patient safety and quality have shown that if the patient and the patient's families get involved in decision making, and they educate themselves, that they have better outcomes. Medication errors injure 1.5 million people and cost billions of dollars annually, from the Institute of Medicine in 2006. In fact, in the hospitals, every day there's at least one medication error per patient per day. There are 2 million hospital-acquired infections per year, and 90,000 people a year die from these infections. Hospital-acquired infections.
I was younger, I was 20 or 22, whatever it was. And I didn't have any, I wasn't an adult. I didn't feel like an adult, and she was in a real weakened state. And somebody came up, an orderly came up to push her, and pushed her into the elevator, and she said she wanted something. I forget whether she didn't know the right spot or forgot her slippers or something. And the way he responded, I was standing right with her, and he responded in a very bullying manner. And it was shocking to me that she was at his mercy. I mean, she was in a wheelchair, she didn't have strength, and I didn't speak up, and I've always looked back on that. And I thought, boy, if that doesn't show me what somebody who is usually at the helm of the surgery, telling people what to do, is now in a wheelchair with somebody else bullying her, how you really become such a completely different person when you are a patient now. As an older person, but I've had more experience with that. But at the time, I was the only advocate she had, and I really failed.
It's a good reminder on how to handle
which is Persons United
difficult situations inside an examination room, and how to ask the doctor nicely to wash their hands, or maybe discuss what I wanted to discuss, because sometimes they're very rushed, and I like that I got reminded again that it's okay to ask questions.
Initially, just sitting in this room, it's a really comfortable venue. So sitting in a comfortable room, you know, listening to what Dr. Farrington was saying, just being in the room with the doctor, talking about her side of this and why she knows it's important, and you know, sharing some scenarios of situations that she herself had been in. Really helped to hear, because as she spoke about that, I was thinking about, you know, times where I could have been more assertive, or times where I really just let the doctor or the physician's assistant or the nurse or the clinician just run the show, and I sit there quietly like I'm 12. You know, I recognize that if I'm in a little gown, freezing with nothing on, it makes me feel 12, and so I tend not to speak. So it's really, really good to hear her say, you know, here's a situation that you could speak up in, and these are some of the words you could say. To be given the words is really good. To be given the words, I would feel more safe if you would be willing to wash your hands once more. I mean, that's a very simple thing to be able to repeat and to be able to use in so many situations. I would feel safe if so-and-so, or it would really help me if so-and-so, instead of just taking his word for it or her word for it.